technical solution. We started with looking at what did the service need and then building the solution around that. So we knew we had to build it from really understanding what it was like to be a person with epilepsy and what kind of services those people need, and then bringing in an electronic solution to support that.
I suppose one of the key success factors with the EPR would be the fact that we've built a system which very much does what clinicians working in the epilepsy service within Ireland use. So what we have is something that's very, very streamlined. Requirements are very much informed from a bottom up from the users rather than from a top down approach.
Hello, the Epilepsy Telephone Advice Line. In chronic disease management, patients require many visits to the outpatient department, and this is really unsustainable as the caseload grows and grows. So in response to that, we developed an epilepsy telephone advice line where patients, when they're having exacerbations or frequency in seizures, can call us. We can respond in a timely manner with either medication adjustments or give them advice if they've to go to their GP or they've to attend the emergency department. Before life without the electronic patient record, this process was very time consuming and it could take up to 2 days to complete that clinical episode. Now we can do it within a half an hour, and really this service would be unsustainable without the electronic patient record.
I'm dealing with patients from various parts of the country. So there's lots of referring hospitals, and there's probably about 5 centres of excellence that would refer directly to us. So in order to try and keep track of these patients and their records, the EPR has been absolutely invaluable. It's really comforting for patients to realise that we don't actually need their physical chart, that we have all the information that has been discussed recently up until the last entry on the EPR. So if somebody in Cork has had some sort of an interaction with their medical team in Cork, it will be instantly visible on the EPR.
I run an outreach clinic to the intellectual disability services, and this allows me to bring epilepsy care to the point of contact in the Daughters of Charity in Clonsilla. Some of the patients who attend the outreach clinic are patients who could not previously have been able to come to the epilepsy clinic because of their maybe their multiple medical needs and some other comorbidities that they had. It may have been impossible for them to come to the outpatient clinic. Waiting in a busy waiting room where they become distressed, it's not ideal for somebody with a severe intellectual disability. So I bring the epilepsy care from Beaumont Hospital to the Daughters of Charity in Clonsilla. And this works really very well, and these patients are now part of the epilepsy service and they receive the same care as any patient who would be attending Beaumont Hospital. These patients then have full access into Beaumont Hospital to the epilepsy telephone service. So I feel that the EPR has facilitated the epilepsy outreach clinic.
A far higher quality of care is offered by the various health professionals, the multidisciplinary team that's using the electronic patient record. So it has a huge impact on people's care on a day-to-day level.
It's revolutionised really what we do in terms of our efficiency. I'm much more confident in my practice because I can see exactly what's been happening for that patient. I can see what my other colleagues have been doing over a period of time. So I feel more confident in my practice. And I think the patients have more confidence in us because we're able to identify with them immediately instead of, okay, I'll get back to you, in a day or two.
But you can imagine a scenario where somebody with difficult epilepsy comes into the emergency department and is unconscious, having had a bad seizure, and there may or may not be family members around who know the information. And by sitting down at one of the computers in the emergency department, one can log on to the electronic patient record and one can go into the patient's details straight away to the patient's summary page with all their information with regard to their epilepsy. And also in an emergency situation, for example, there are some anti-epileptic drugs like phenytoin that some individuals are allergic to, and that information will be on the electronic health record as well. So that information is essentially instantaneously available for the optimum care of this individual.
It's very important for an organisation to have the most complex patients on the system because they're the ones who are in contact with the service most often. And there's a critical point at which the EPR becomes not only useful but sort of invaluable. Having the first 500 complex epilepsy patients done was just an incalculable difference to us. Now we're nearing 1,000 now on the EPR. The numbers nationwide are 6,000. That's probably in the region of about 50 to 60% of the most complex epilepsy patients in the country. So that's quite a remarkable number. And there's the obvious benefits and then the more subtle ones.
So having a tool like the electronic patient record has really helped our research because it allows us to quickly access very high quality details on patients that's captured at the point of clinical care. With this information, we can then correlate the genetic profile of these patients with the different outcomes that they've had to treatment. And in this way, it helps us to identify genetic factors that would predict who should go on to a particular treatment because we think it should be safe for them and also be effective for them, and critically who should avoid a particular treatment because they might be at risk of having an adverse reaction to the treatment, or perhaps they're less likely to respond to that particular treatment.